So once you've been bitten, you want to be keeping an eye out for symptoms of Lyme disease, especially within the month following after your bite. Although sometimes the infection can take longer to present itself, you want to especially be looking within the first month. So keep an eye out for a rash that would develop, commonly near the bite area, but it could actually be anywhere on your body. And if the rash is larger than a $50, then it would probably be the Lyme disease rash. But if it's smaller than that and it's centered on the bite, then it is probably just a reaction to the bite and not Lyme disease. If you develop flu-like symptoms, especially in the middle of the summer when it's not flu season, then that's suspicious. If you get fever, chills, joint pain, persistent fatigue, if one of these things crops up after you know you've been bitten, then you should be thinking Lyme disease and start getting it checked out. And if you've been bitten by a tick, then you want to consider getting preventative antibiotics because Lyme is treated most effectively immediately. The longer you wait, the more the bacteria has a chance to spread throughout your body and it gets more difficult to treat. So you would consider the species of the tick. So if it's a dog tick, then you're not really worried about Lyme disease. But if it's a deer tick or a Lone Star tick, then you'd start to be concerned. And then you consider how long the tick was feeding on you, based on when you were last outside and when you think you got it, and how big the tick is, like how full of blood it is. So if it was on you for less than 24 hours, then you don't really need to do anything. If it was on for more than 24 hours, then it's possible that it has transmitted Lyme disease to you. So I would urge you to consider preventative antibiotics. You'd have to talk to your doctor and see if your doctor is willing to prescribe it for you. And then you consider how it was removed. If it was removed properly in less than 24 hours, then you're okay. If it was removed properly even after 24 hours, you should be concerned. But if you removed it improperly, regardless of how long it was attached to you, then be concerned and consider antibiotics. When you're looking to get antibiotics, don't wait for tick testing. Sometimes your doctor could send out the tick to get it tested. Usually it's tested to see, it's basically identified what species is it and how long has it been feeding on you. They don't typically analyze it to see if it was carrying the Lyme disease bacteria. So you're not even getting that information about whether it carried Lyme or not. And it takes a couple weeks to get the results back. And that's time that you don't want to wait for the infection to be spreading. And don't wait for a blood test. Besides the blood test being inaccurate in sort of normal circumstances, it's not going to detect anything immediately. When you have a localized infection, your immune system hasn't really responded to the bacteria yet. The blood test isn't even supposed to be good until several weeks after being infected. So don't wait for a blood test if you've just been bitten. Or even if you see a bullseye rash, that's not the time to do a blood test. That's the time to get antibiotics. Because even with the rash, that's a localized infection on your skin, and your immune system may not have responded and may not show up on a blood test. Okay, so to prevent Lyme disease, we need to recognize when we're at risk, avoid being bitten by ticks, check for ticks and remove any that we find, keep an eye out for symptoms of Lyme disease, and then consider antibiotics after a tick bite. Now I've covered a lot of things that we can do to prevent Lyme disease, which can be kind of overwhelming. But I picked out a few things that I think everyone can start with. And the first is to know when you're at risk. Consider when you're around tick habitats. and then commit to daily tick checks when you are exposed to ticks, when you are in these areas where the ticks could be. Another thing you can do is get a tool to remove ticks, so that when you're doing your daily check and you find one, then you'll be prepared to remove it. So get a fine point tweezers or some other tick removal tool and have it on hand. Another measure that I think most people can do without too much extra effort is dress to repel the ticks. Wear long pants instead of shorts. Tuck them into your socks and use bug spray. Most people keep bug spray on hand. So even if you weren't really worried about mosquitoes, be worried about ticks and put on some bug spray. And then I would suggest just consider some of the other methods that I mentioned and think about which makes sense for the next step for you and for your family. Maybe you'll get some permethrin-treated clothing, or change your pet policies, look over your pet before they come inside. Maybe you'll use the tick tubes to kill ticks on the mice, or make some landscaping changes. And all these preventive measures are listed somewhere on the handout you got as you came in. So at this point, if anyone has questions, I'd be happy to answer them.
Yeah, so if you get bit, why don't you just go to the emergency care place in Fayetteville and have them take it off and get a dose of antibiotics and don't even worry about it. I got bit twice, and I just hop in the car and I go. Why wouldn't that be an option?
Some people are exposed to ticks a lot more frequently, and so if you're picking ticks off you every day or a couple times a week, you probably don't want to run to the ER every time. And the doctor at the ER probably isn't identifying the tick for you. If it's a dog tick, you probably don't even need antibiotics. So you would be taking antibiotics unnecessarily really frequently if you got bit a lot of times, or if you got bit frequently. But those are some reasons I could think of, but if it's not that often, maybe you just go there. Also, I don't know if they know how to remove the tick properly or not. I've heard stories about people saying they've been to a doctor's office, or, not locally necessarily, but that they've seen how they've been removed and that it's not the best way. They might have been squeezed or twisted or something like that. Yes? Permethrin. You can find it on the internet. On the sheet, on the handout sheet. On the side that says Lyme disease prevention tips, in the lower left corner, there's it says rhino skin, and then it says permethrin, and it gives you several brand names. So you could search for those on the internet, or you could go to a local store and ask them if they have it. Do you see it on that sheet? Yes, Joan? I had a Western blot done at a laboratory that specializes in testing for Lyme disease, and their Western blot is more accurate. The regular one's about 70%, and they only do it after they do the ELISA test. But at this laboratory, I think theirs is as good as 95 at least. I tested positive on that, and when I went to see the Lyme doctor, he looked at all my labs and he said, well, we've ruled out everything else, and your symptoms tell me that you have Lyme disease. Any other questions? Natalie? It's the primary way. A pregnant mother could pass Lyme on to her child. Some people are concerned that it could be sexually transmitted, but I don't think it has been demonstrated at this point. But it is a spirochete type of bacteria, and syphilis is also a spirochete. So there's some precedence or some thought that it could be. And some people have suggested that mosquitoes and other biting insects could transmit Lyme disease, but it hasn't been fully proven yet. Any other questions? Okay. Well, I just want to make you aware of some of the resources that we have up front. Actually, first, the sheet that you all got when you came in, there's a box in the lower right-hand corner that says upcoming events. And these are all events that will take place in May and not March, as it says. So there's a Lyme literate doctor coming to speak in May with the IGeneX rep, and IGeneX is the laboratory that specializes in Lyme disease testing. And then there will be some public screenings of Under Our Skin, which is a documentary of Lyme disease. Very fascinating. We have 2 scheduled right now, but we may add some more. And then out on the tables, we have this booklet about Lyme disease called The Basics, a plain language introduction to Lyme disease. And this is really well written, and I recommend that everyone get a copy. It talks about the symptoms, it talks about the different co-infections, how you might get diagnosed if you think you have it. It talks about some prevention methods and just some other questions like, is there a vaccine, or things like that, or why there isn't a vaccine. And there is this sheet outside, which is, it's about DEET and permethrin. It's from the State Department of Health. So they give you guidance in choosing a DEET percentage, as well as they tell you how to treat your clothing with permethrin. And then there's other items out there. Some are meant for doctors, some are meant for people who hunt or people who work with children, teachers and nurses, so that they can recognize if a child is presenting symptoms of Lyme disease. And just the final thing, if anyone is interested in receiving prayer, we'll have a couple church members up front afterwards if you'd like prayer for healing or for another concern that you have. So that's it. Thank you.